Tonight's workshop is hosted by Katy Clouse, Executive Director at the Arc of Williamson County. Not only is Katy a close personal friend of mine, she has over 24 years of experience working with people with intellectual and developmental disabilities. That means we can learn a lot from her. So, without further ado, Katy, the floor is yours.
Hi, thank you guys for coming. So this is the first time that I have offered this presentation virtually. I've done it in person a few times, but so bear with me if I have any technical issues. We are recording this presentation and hope to make it available on our website. There, there are a lot of acronyms in this world, and I will try really hard to define the acronyms the first time I use them. But if I get to talking too much and I forget, please ask me to define what I'm talking about. Also, when you ask questions, there may be some that require me to look at the details of your specific case. So I may ask you to follow up with me later by email. We also have a number of service providers on here. I only know what I know. So if you have additional knowledge and resources to add, please contribute. I learn new things all the time, and I know that there are a lot of people out there that know more about these programs than me. So the topics that we're going to cover today are Social Security, TennCare, Medicare. We're going to go over the waivers. We're going to talk about vocational rehabilitation, TEIS, which is Tennessee's early intervention system, family support, the Individualized Education Account, MAPS, and Tennessee Strong Families. So remember that this is an overview, and each of these programs honestly could be their own presentation. So we're going to give you links for many of them so that you can do further research. And if you still have questions, you can send me an email or give me a call. So I like to show this slide at the start of this presentation because I increasingly find that people don't understand what funding source pays for what things. So folks with IDD, they have living expenses just like everybody else. Social Security and or employment is their income. And they will use their income to pay for living expenses just like we do. Most of the time, an adult with IDD is going to have a representative payee, and that might be a parent or a sibling. A lot of times it's a residential provider. Being an adult representative payee does not mean that the money is yours. It means you're helping someone manage their income. A person's health insurance covers their major medical expenses, just like you or me. Medical insurance generally covers preventative care and care for acute conditions, and that's going to be like a broken leg or pneumonia. If a person has both Medicare and TennCare, their Medicare is always the primary insurance, with TennCare being secondary. TennCare is always the last insurance payer. Even when a private health insurance policy is in the mix, TennCare is always last. And then LTSS, which stands for Long-Term Support Services. Waivers are long-term support services. So is a skilled nursing facility, intermediate care facility. Those are also long-term support services. And we're not going to cover skilled nursing or ICF, intermediate care facility, but you can always reach out to me if you have questions about either of those. So if a person's enrolled in a waiver, that waiver covers the services in the person's home, day employment services, and other support that they need because of their disability. Being a long-term support services means that waivers are for long-term chronic conditions. Waivers do not cover living expenses. Waivers pay for services. Waivers do not provide lump sums of money to people in services. They only pay for the services that the person needs. Most waivers have a spending cap, and all that means is that the services that you need must stay under that cap. I see a question. Doesn't TennCare cover dental? Yes, TennCare does now cover some dental. It will not cover sedation. And so folks that need sedation, generally a waiver will pick that up. Okay, so
Katie, real quick, we have another question. What is meant by day employment services?
Yeah, so day and employment services, that can look like job coaching, it can look like exploration or discovery, like helping somebody figure out what it is they want to do, and then kind of giving them shadowing experience to figure out if this is the job that they want. Then job coaching, help with job placement. Also, because that's not a realistic goal for some people. There are other services that can happen during the day, personal assistance, just community. I'm not sure what the service is called in ECF, but in the 1915C waivers, it is community participation. So just helping people be active members of their community and having social roles, just like everybody else does. That is supposed to be included as, I'm sorry, there's a question in the chat. Would that include covering transportation to and from the employment if the disability limits their ability to drive? So we're going to talk some more about vocational rehabilitation, and that is definitely a service that they can help with. In the waivers, a lot of times that service is supposed to be included in the daily rate for service. It's not like a standalone transportation service if somebody's receiving employment supports. Okay, so let's dive into Social Security. There are two types of Social Security payments, and they are supplemental security income and Social Security disability insurance, so SSI and SSDI. The main thing that I want to highlight here is that SSI is paid from federal income tax dollars, and that's what's withheld from your paycheck and what you pay in taxes every year, so like the general treasury fund. SSDI is paid from the Social Security Trust Fund, and this is the Social Security tax that's deducted from your paycheck. SSI is a means-tested program, and that means that there are income and resource limits to be eligible for the program. Social Security is looking at whether or not you have the means to take care of yourself. SSDI is an entitlement program. That means that a person has paid into the Social Security Trust Fund, and they are entitled to take that money back out. And there are not resource or income limits with SSDI. So let's get into SSI just a little bit more. So in 2024, the maximum amount that a person can draw for SSI is $943. To be eligible for SSI, there are two determinants. The first is disability eligibility, and the second is financial eligibility. So when you apply for SSI, you have to prove that you meet both. Financial eligibility includes resources and income. So when a person is under 18, Social Security is going to look at the parent's income and resources as part of that eligibility determination process. Once a person turns 18, only their income and resources count. So the parent's income is no longer considered. Once a person is eligible for SSI, they are also eligible for TennCare, and it is automatic. They just enroll you in TennCare. So a person can work and get SSI at the same time. I hear a lot, oh, I don't want to lose my benefits. Well, you can work and get SSI. Social Security will deduct about $1 from a person's monthly payment for every $2 of earned income. So the resource limit for SSI is $2,000. And fun fact, that has not changed since 1989. If a person wants to have savings, they can consider an ABLE account to shelter some of those resources. Social Security will disregard the first $100,000 in an ABLE account. So I've included the links for both of those on the slide, and then Amanda, I believe, has dropped them in the chat. So a quick note on income and resources. So Social Security defines income as any item that a person receives in cash or in kind that can be used to meet their need for food or shelter. This means that if your 18-year-old is living in your house rent-free, the room and board that you provide them is counted as income by Social Security. So you can get around this by charging them rent each month to live with you. And the easiest way to track income and spending for that person is to get them their own bank account and to have their Social Security just directly deposited into that account. Then you can charge them rent from that account and show where they paid you each month. One of the ways that they determine financial eligibility is that they want to see a person's bank statement, and that will show absolutely what the expenses are and income going in. For resources, some things are excluded, including one home of any value, one car of any value, furniture, clothing, and other personal care items, burial plots, and some types of life insurance. So special needs trusts can also shelter some resources, as can ABLE accounts. And if you want to know more about trusts and ABLE accounts, please join us next week. We have a workshop with Luke Bodorf and Matt Mosier, an attorney and a certified special needs financial planner, and they're going to really take a deep dive into financial and legal. And know way more about it than I do. All right, so SSDI, also known as disability benefits or retirement. So SSDI eligibility is based off a person's work history and how long a person paid into Social Security, which makes it an entitlement program. So you paid that money in, and now you're going to receive payments from the money that you paid in when you worked. A person with a disability can also draw off their parents' contributions if the parent retires, files for disability, or passes away. After a person draws SSDI for 24 months, they become eligible for Medicare. If a person must pay a premium for their Medicare coverage, and some people do, Social Security will deduct that premium from their SSI. And I believe Amanda is going to drop the link for information on SSDI in the chat. So you may run into cases where a person receives both SSI and SSDI. So this usually happens when a person qualifies for SSDI and their payment is lower than the SSI amount of $943. So you can end up drawing both. Let me just pause for a second and see if there are any questions about Social Security. Do we have?
Yes, Katie, there are a couple of questions in the chat.
Okay. Let me see if I can get to the chat.
I am pinning them for you.
All right. Oh,
if that helps.
How do I know whether our daughter is getting SSI or SSDI? So does your daughter have TennCare? So that's Julie. You can unmute.
Yes.
She gets TennCare, then she's getting SSI. Does she also have Medicare?
Yes. So we were in California. She got her Medicare and her SSI, I guess,
Mhm.
while we were still living in California after she turned 18. And then moving to Tennessee, then, the TennCare came later, but she does
Okay.
have it.
So she had Medicaid and Medicare. So if she's only getting one payment and she has Medicare, then it's probably SSDI. And if you want, I
It
can.
is only one payment.
Okay, then it's probably
I can email you.
Yeah. Yes. Yeah. I'm happy to look at it.
Okay. Thank you.
Usually it says if it's direct deposited in the account, it'll say, if it's SSI, it'll say supplemental security income. And if it's SSDI, it'll just say Social Security Administration or something along those lines on your bank statement. But yeah.
Okay, I'll look at that too.
Yeah. If the person draws from a parent's retirement, does it diminish the parents? No. Do they get the full amount of the parents or just half? I honestly don't know the answer to that question. Social Security and some of the formulas that they use are just way above my pay grade. And so I don't know that I can answer that question, but you know what? I can probably find out for you, and maybe email it out to the group after this. So let's talk about health insurance. Oh, how do I know how much to charge as rent? It really just depends on, what your overall like rent payment for your house or your mortgage. If your mortgage isn't astronomical, then, their portion. So if your mortgage payment is, $1,200 and 4 people live in your house, then their portion of that would be $300. So that would be that's the way I usually advise people. So TennCare. So TennCare is Tennessee's Medicaid agency, and TennCare contracts with 3 MCOs to coordinate benefits for TennCare. Blue Care, WellPoint, which used to be AmeriGroup, and United. So when you're enrolled in TennCare, they're going to assign you an MCO, a managed care organization. And you can change MCOs during their enrollment period each year. So the link on this slide is the eligibility reference guide on TennCare's website. And it looks like Amanda dropped it in the chat. So if you will click on it, if you're able, I'm going to try and share it so we can look at it together for just a second. I'll start up here at the top. So it took me a long time before I really understood this chart. So I really want to go over it with you. So the top chart is for income eligibility, and it is figured based on the federal poverty level, which is FPL. So if you are looking at the first column, it shows that in 2024, 100% or the federal poverty amount is $1,255 per month. So you can see the corresponding percentages as they go up. And this chart is really just a reference for the bottom charts. So I just want to tell you how to read this so that, like I said, it was very confusing to me for a long time. So just a reference. So the third chart on here shows the different eligibility categories for TennCare and how a person can qualify for each. So most of the folks that we would be working with would be under the aged, blind, and disabled category, and then the Medicare cost sharing categories. And we'll talk about that more in just a minute. Most of the time, the folks that we work with are going to be eligible based on SSI, institutional Medicaid, Katie Beckett, and then ECF choices. So you can look in this last column and you can see the income and resource limits for each of those. So for Medicare, as we talked about earlier, if a person is drawing SSDI, Medicare let's see, as we talked about earlier with SSDI, if you draw SSDI for 24 months, then you'll be eligible for Medicare. So Medicare is for people who are 65 and older and adult children with disabilities after they've drawn SSI for 24 months. Medicare has 3 parts. Part A, which is hospital coverage. Part B, which covers doctor's office visits, medical equipment, preventative care, outpatient care. And then Part D, which is the prescription drug coverage. And if a person's income meets certain qualifications, they may also be eligible for a Medicare savings program, which is also called a cost-sharing program. And that will pay for some, maybe all of their Medicare premium. Medicare cost sharing, I don't want to get too mired down into it, but I want you guys to know that there are several programs out there that will cover a person's Medicare premiums when a person is eligible for both TennCare and Medicare. These are the 2 I see the most, QMB and SLMB, Qualified Medicare Beneficiary and Specified Low Income Medicare Beneficiary. If we go back to the eligibility chart over here, they are on the last page, and you can see the exact amounts. And then remember, so if you are up to 100% of the federal poverty level, then you go up to that top chart and you can see what 100% of the federal poverty level is. So anyway, these are the 4 programs. So eligibility for these programs is redetermined regularly, but at least once a year. TennCare does these determinations when they do their financial recertifications. A lot of us have been going through that this past year. They had taken a break from it and started it back, I believe, around July last year. So those financial recertifications will also recertify any of the Medicare savings programs that there are. So there's a hard line for eligibility. Either you make too much or you don't. So you could be $1 over the amount and have to pay a $150 premium. You can be $1 under and pay no premium. So these are 2 more of the cost sharing options. Eligibility for both is also on that TennCare reference guide. All right, so let's pause here and see if there are any questions about TennCare and Medicare. No?
Katie, I'm not seeing any current questions at this moment.
Everybody, wow, did I answer everyone's question, or is everyone just thoroughly confused and doesn't even know what to ask?
Yeah, I'm just going to unmute.
Yeah,
quick,
no, great, please.
So this is our first, I guess, dive into this, and it's very overwhelming. And I know that you know what you're talking about. My question is there the option through your service to maybe pair up with someone to kind of walk us through this process of how do you apply for all of these things and all of that?
There's me, just me, and but I'm happy to walk through it with you. I tell most people that the first thing when your child turns 18, go ahead and apply for Social Security, and if you feel like they need help with decision making, look at a conservatorship or power of attorney, or just really look at their decision making. And then from there, because Social Security makes you eligible for TennCare, from there, it's a little bit easier. Like if you just look at that one task, Social Security, some people ask for, oh, what else should we be doing? Can you give me a list? A list like that is super overwhelming. And, you know, I'm more than happy to talk anybody through this process because it is really hard. And government websites don't make it easy. But I'm happy to walk through it with you. But we don't have like a coordinator that does that, just me.
So what would be the best way to connect with you for that? Just send you an email?
Yeah, just send me an email and we can schedule
Okay,
a time to sit down and talk through what's going on with you.
thank you.
Yeah.
Katie, there is another comment from
Yes.
Marcia in the chat. She's frustrated with the process of trying to get TennCare. She's been trying for 2 years and still nothing.
Okay.
Any advice for her or any comment on that?
I'd have to look at your specific case and look at what's going on with it. If they are hedging on the disability determination, then you can appeal that pretty easily. If they're hedging on the financial determination, that's not generally something that you can appeal unless there's something that they have totally wrong. But I'm happy to look at it. Yeah, just reach out to me.
And there's a question about conservatorship and how do you get it?
Okay, so that is a whole other presentation in itself. I do encourage you to come to our workshop next week with Luke and Matt. Luke is an attorney who does a lot of conservatorships for us. Yeah, Luke did somebody else's. I see that. And he's great. He actually did all of my stuff also, special need or trusts and will and everything. So next week is not virtual, but it is at 6:00 and it's in person. I hopefully will be able to offer another one virtually. The way that they do their presentation is not like, I don't know that it would be conducive to a virtual presentation. However, I just recently wrote a grant to upgrade our technology, and I'm hoping that once we get our meeting technology upgraded, that we would be able to offer that in person or virtually and in person. So it's at 6:00 next Tuesday here at the ARC. So now we're gonna get into Tennessee's waivers just a little bit. We're gonna kind of go in chronological order here as far as serving kids all the way to adults in waiver services. So let's tackle Katie Beckett first, since she is the reason that we have all the waivers. So this is Katie Beckett. She was born in 1978 with significant medical conditions, and she was in the hospital for 3 years. And all the time that she was in the hospital, her mother, Julie, spent fighting for the ability to care for Katie at home. And because at that time, Medicaid would not fund any services in the home, only in institutions and hospitals. So she successfully convinced President Reagan to support the first Medicaid waiver, which a waiver is basically just an exception to Medicaid rules. So in Tennessee, our Katie Beckett waiver was created to support children who have disabilities or other complex medical needs and don't meet financial eligibility for Medicaid because of their parents' income and assets. So there are 2 parts to the Katie Beckett waiver. Part A is a pathway to TennCare eligibility, and children who are eligible for Part A meet the level of care for an intermediate care facility, but they're choosing to receive services at home and in the community instead. So it's basically Medicaid, TennCare. And if you remember on the eligibility chart, Katie Beckett waiver was one of the eligibility categories. Part B is funding of up to $10,000 per year to help cover the costs of private insurance premiums, and then also covering costs that insurance doesn't cover. There's also some direct services in there that would be provided through a provider agency. And then there's also, you can self-direct some services as well through Katie Beckett. which means that you would hire staff and work with a supports broker to manage the training and payroll and all of that kind of stuff. So the legislature recently approved a bunch more slots, and the new enrollees will have independent support coordinators. Their DIDD is contracting that case management out. And we are providing ISC services for children in the Katy Beckett waiver now. Just started that in March. Okay, so ECF. The ECF waiver is the long-term support service that is supposed to help people become employed and live as independently as possible in the community. So there are different groups that offer different types of services and have different cost caps. So Amanda's going to link that table in the chat. And if you click on it, the table will show you the different groups and the services that each group covers. So the groups run from group 4 to group 8. Residential services, which in the ECF waiver are called community living supports. They're available in groups 5 and 6. Groups 7 and 8 are time limited, and they are for people who need intensive behavioral supports. So the link to the application for this is also in the chat. It's important to know that this waiver is managed by the managed care organizations. So if you are already with TennCare and have an MCO assigned, then you'll be assigned a support coordinator with that MCO who will visit you and will help you submit for enrollment and eligibility. Once enrolled, there are some services that are available for self-direction, like the Katy Beckett waiver. And that means that you don't have to go through a provider agency or staff. So, and again, if you decide you want to self-direct, then your support coordinator would connect you with a supports broker agency. And I think that CDTN is who has that contract right now. But they'll assist you with payroll, making sure that your staff meet the qualifications to provide the service. So there is a waiting
Katy,
list. Huh? Yes.
Sorry, there's 2 questions in the chat real quick.
Okay.
Julie K says, so waivers apply to only children under 18?
Only the Katy Beckett waiver. So the Katy Beckett waiver is for under 18. The ECF waiver, and then we're going to talk about choices also. They are for really everybody, but you know, I generally think of them more as for adults. So.
And then Rich has a question. If you are on a private insurance with family coverage plan, would any of the Katy Beckett waiver funds cover?
Yes. Yeah. So the thing with the Katy Beckett waiver is that you can't meet financial eligibility for Medicaid. So like we do annual financial recertifications for Katy Beckett waiver, and we're looking at, do the parents' income, like, do they qualify for Medicaid? Because then they wouldn't qualify for Katy Beckett. They would just qualify for TennCare. So most of the kids in Katy Beckett are with parents who have insurance, but like most of the insurance for folks doesn't cover 100%. So like if you have somebody with significant disabilities, say they just had a hospital stay and it was $100,000 for everything that was done. You know, if you've got a insurance policy that is at 80% coverage, you still have a lot of money, $20,000 there that your insurance didn't cover. So Katy Beckett is supposed to kind of fill that hole a little bit. And so that families are not, you know, don't have this huge financial burden that they would have otherwise. So yes, if you have private insurance, you can absolutely still get Katy Beckett. And in that case, your private insurance would be the first payer, and then TennCare, if you have Part A, would be the secondary payer. Or if you have Part B, then you can have, there's a health reimbursement account that you can get through Part B. And I encourage you to look at the website for Katie Beckett and see what all the services are, because there are a number of services. Health insurance, premium assistance. There's, and then there's the direct services too. Non-traditional therapies, personal assistance. There are a lot of different services within it. Most people use the HRA account or the health insurance premium assistance.
Katie, we have 2 questions about the ECF waiting list. So
Yeah.
do you have any insight on that?
Well, I have a whole thing here that I was getting ready to say about it, but
we will wait patiently. There you go.
okay. I'll pull the chat back up. Yes. How do we know? Okay. So I don't know anything about the timelines. The ECF waiver is managed by the MCOs. So there's only so much I can tell you about what the waiting list looks like. I can tell you that they do have groups for immediate coverage, and then they also have groups for what their priorities are for what they are wanting to serve in there. So folks that qualify for immediate coverage are people who have aging caregivers. I believe, I'm not sure what's considered an aging caregiver. It's just said aging caregivers on all the material I have. Emergent conditions like homelessness, a caregiver's deceased, or there's major behavioral concerns, multiple complex health conditions, and folks who are under 21 and needing behavior support. I would suggest that if you think that you have any of those conditions going on, that you contact the support coordinator that came out to see you and update them on your situation. ECF does have priorities for enrollment. They include people who already have a job and need support to maintain that job, people who are transitioning from school and want to work, somebody who's recently unemployed and may need help finding a new job, and then transition age students 18 to 22. So when you are filling out the application for the ECF waiver, I highly suggest indicating on that waiver or on the application that you're interested in working, because that's their priority. So did that kind of answer your question? I know we don't provide services in the ECF waiver, so I only know it here. So I have no idea why the powers that be decided to name 2 waivers with the same name, but here we are. The choices waiver, not to be confused with ECF choices, is for adults over 21 who have a physical disability and for seniors who are 65 and over. So this waiver is often easier to get into than the ECF waiver. It has the same Medicaid eligibility as the ECF waiver and also has some services that can be self-directed. So this waiver has 3 groups. Group 1 is for folks who are in a nursing facility, and it pays for that nursing home care. Group 2 is for those who meet nursing facility level of care but choose to stay at home. And group 3 is for people who are at risk of needing nursing home care but can receive services at home to delay or prevent the need for nursing care. So group 3 is generally where most of our folks are going to fall into if they have a physical disability. So it is important to note that choices does not specifically serve folks with IDD. So it does serve folks who have an intellectual disability, which often co-occurs with intellectual disability. So this waiver is coordinated by the Greater Nashville Area Agency on Aging and Disability. I always screw that up. And their contact information is on this slide. All right, I do want to mention that there are 3 other waivers out there. They are all closed to new enrollments. They're referred to as the 1915C waivers, and there are 3 of them. I only want to mention them because you will run across people who are receiving services in them. So there are other programs that I want you guys to know and be aware of. And we're going to go in chronological order again, starting with littles and moving on up. So I know that we have some, or I'm hoping we have some early interventionists on here. So, chime in if you are, have other information other than what I've put here. The federal government provides funding for early intervention services from birth to age 3. Tennessee has extended these services past a child's 3rd birthday until the start of school following the child's 5th birthday. And those are through state funds. So to be eligible, your child has to have a current individualized family service plan through TEIS, the Tennessee's Early Intervention System. Then they also have to be determined eligible by the school district special education services. So if you're eligible for both, you can choose to receive services through your IFSP, or you can choose to receive services through the school district under an IEP. A lot of acronyms there. Individualized Education Plan is IEP. Tennessee Strong Families is a state-funded program. It is for children who are in DCS custody and are in foster care and have an IDD diagnosis. They can also be under 6 with a developmental delay. And the referrals for this program come from DCS to DIDD. The program provides a healthcare reimbursement account of $20,000 authorized from January 1st to December 31st of each year. And the foster family can use these funds for medical needs that are not covered by TennCare. I just wanted to mention them. I don't know if we have any foster parents on here, but just want you guys to know about that. And we are providing case management in Tennessee Strong Families. The Individualized Education Account. So this is a program that is a school choice program for eligible students with disabilities. So if a family determines that the school district is not able to meet the unique needs of their student, then they can apply for the funds that the school receives to educate their child. The child must be a resident of Tennessee and have an active IEP, and only certain IEP categories apply. You have to be eligible under autism, deafblind, developmental delay, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, specific learning disabilities, or traumatic brain injury or visual impairments. So I've listed some of the approved uses on the slide. There's a handbook on the Tennessee Department of Education website, which is tngov/education. And it gives much more detail than will fit on this slide. So once a child is enrolled, the parents will receive a debit card for each student, and funds are dispersed each quarter onto the card. The funds are considered taxable income, and the families will receive a 1099 for them. Really, there's just a lot of things that can be used for, all education related. All right, so the MAPS program, Medicaid Alternative Pathways to Independence, is a state-funded program for folks with IDD who are exiting the school system or who've recently exited and may be waiting on traditional waiver services. So those of you who are on the ECF waiting list, you can apply for this program and get some services. The program is through DIDD, and it will assist enrollees in developing their own virtual community resource map to help them establish community networks and independent living skills through supports. MAPS uses the same network of IDD providers that the ECF waiver uses. So I think Amanda has linked the information about MAPS in the chat. Okay, vocational rehabilitation. So VR is a federal, IDD stands for Intellectual and Developmental Disabilities. So vocational rehabilitation is federally funded, and it is for people who are experiencing physical, mental, or sensory challenges that affect employment. So VR has 2 areas of service. The first is for Tennesseans with disabilities, and then the second is for Tennessee business owners who are interested in employing workers with disabilities. So the VR services for folks with disabilities are, there's so many. Pre-planning, career readiness services, which is like applications, work ethic, communication skills, conflict resolution, understanding your paycheck, and then job placement and coaching, which is kind of what most people are know about. They'll also help with like driver's license test prep. They can help with mock interviews. I believe they offer a job interview class. And then there are also programs within VR that can help with specific trainings and certifications that a person might need for a job they want to do. And then someone had asked earlier about transportation. VR, if they need transportation to get to work, VR will help with that. They can help with bus or trolley tickets. If you've got a car that you need to get back and forth to work, they can help with the repair on it. So just they do have a whole transportation piece that's worth looking into. In addition, they have several special emphasis programs. TRC is a training center that provides career and technical education to prepare people for independence and competitive integrated employment. So it is a residential campus for adult learners with disabilities. And it helps them build job skills, gain certifications, and achieve credentials. So they provide transitional services for the blind and also focus on functional and foundational skills for students who are blind or visually impaired. They also offer a bunch of certifications. So like for a person who might be interested in automotive service, they can get a certification for that. A CNA, certified nursing assistant, they offer certifications for that. And production technician, custodial technician, childcare worker, food service, pharmacy tech, like they have all of those certification programs there. They also have services for the deaf and hard of hearing and services for the blind and visually impaired. All of those services are similar to what's offered through VR with the addition of interpreting, provision of hearing aids, and some other adaptive devices. So I believe Amanda's put I can't see the chat, the link in the chat.
Katie, we have a few questions if you want to
Yeah.
address those in the chat.
I can't.
First of all, Mary has her hand raised.
Oh, okay.
So I'm not. Mary, do you have a question?
Can you Can you hear me?
Mm-hmm.
Yes.
Oh, good. Okay. You went over the 1915C waivers,
Yes.
and I had one question. I don't think a lot of people are on the 1915C. That's why it's kind of complicated. But can you switch back and forth? I think you put up a slide, and I don't remember it. I should have caught it then. That said there were two other things. It was 1915C waiver, and then it said self-directed or self-managed. So is that closed, or is that still open under the 1915C waiver?
No, none of the 1915C waivers are open for enrollment. So the people that have those waivers are kind of grandfathered in, and there's no like moving between waivers. Like if you decide to disenroll from a 1915C waiver, there's no process for re-enrollment. You would lose it. So
Okay.
so
But
the,
you mean,
go
go
ahead.
ahead. I'm sorry.
Well, I was just gonna say so there are three 1915C waivers. There's the self-determination waiver, and it has a really pretty low, it doesn't have residential services in it.
Okay.
And it is just a lower cost cap. I believe it's $30,000, but it might have increased. I'm not sure. If there's anybody on here that has a self-determination waiver and wants to correct me, then that would be awesome. And then there's the statewide waiver, which has an annual cost cap of $236,450. And then the cost aggregate cap waiver, which does not have an individual cap on it.
So,
yeah.
So those three, you're saying that if you're on one, you can't switch to, because I've heard of the 1915C called the statewide waiver, the big one, and things like that. So I guess you're saying that I don't remember what you called the last thing, the cost aggregate.
Yeah, the CAC waiver.
The CAC waiver.
Yeah.
That is what kind of waiver? That is within the 1915Cs that are closed, correct?
It's one of the three waivers.
Okay. And
the people that are
it do?
Yeah, it's the same as the statewide waiver. It just doesn't have a cap. And the people that are enrolled in that waiver are people who have high medical needs, high behavioral needs, or they came out of an institution.
Okay. The reason I ask is because the people that have, as you said, it's weird that they put choices and they have ECF choices. This has confused me a lot. So I listened tonight, because it confused me because I'm trying to talk to other parents and find things out. But on the ECF, or I think it's the ECF now that you've explained it to me, the parents can somewhat self-direct and they're able to pay enough of a salary to get help inside their homes. Yet I am told that I have the big one, and that's that one with the $236,000 cap.
Right.
And I can't budge. I can't hire anybody.
Yeah.
Do you know why that is?
So the way that those waivers were written, you cannot self-direct in them. There is a proposal that's at the Center for Medicaid and Medicare Services with the federal government to integrate the 1915C waivers with the ECF waivers. And CMS has had it for, I want to say, like 2 years. And if that is ever approved, it adds a self-directed option to the 1915C waivers. But I don't know anything about when or if it will be approved. But that is something that they're trying to get. But that's just not the way that the waivers are written right now. Because remember, a waiver is an exception to Medicaid rules. So they have to write all the specific exceptions in there. And that is not a specific exception that was written into the 1915C waivers.
Okay, thank you so much.
Yeah, no problem.
Okay, Katie, we have another question. Julie K wants to know, is there a way to receive payment for caring for your adult IDD children at home? Some states have this and some don't. Just not sure about Tennessee.
So it depends on what service. So if you're providing, if there's personal assistance, I'm not sure what it's called in the ECF waiver, I'm sorry. But it's, people coming into your home and assisting with your care. That is something that you can be paid to do for your loved one. You have to go through an agency. You can't self-direct yourself to provide personal assistance or any service, but you can go through an agency, and the waiver would contract with that agency to provide the service, and then you would be an employee of that agency. If you're a conservator and you want to be the staff for your loved one, then you need to make sure that the order of conservatorship says that you can receive payment to provide personal assistance or whatever service it is. Respite is also a service that you can't be paid to provide for your loved one. Does that make
There's
sense?
a couple more questions.
Okay.
Kim can't get TRC in Smyrna to call her back. Do you suggest her just showing up Tuesday or Thursday at 10 a.m. or 3 p.m. tour times?
I don't know the answer. Send me an email because I will give you the contact information for some of the coordinators. Supposedly we have a coordinator for Williamson County. I just learned that last week, and I can give you her information, and maybe she can help grease the wheels a little bit. So send me an email.
So Katie, we got 2 more questions. TM wants to know, what if you live in the suburbs and buses are not available?
Yeah, so I don't know. This is an ongoing issue. In fact, a couple of years ago, the transition students at Brentwood did Disability Day on the Hill with us, and they brought that up, that they are having a hard time getting to work because there's no public transportation system in Brentwood, and if their parents don't take them, then they can't get to work. So it's an ongoing issue, and I don't have an answer for it.
Okay, and Coakley has a question. We have 2 kids who worked with VR, and they did not provide any transportation help despite repeated requests.
Okay.
So, and also Courtney says, do you apply for this like you do the waivers? Should we wait till after T2?
Okay, so so the schools are supposed to have what's called a TSW worker, which is transition school to work. I don't know how well that's working with the schools because I don't really see VR in the schools like I used to when they had an office here. I just don't know. I see Amanda shaking her head. You don't see him either? Okay. But it is something that the schools are supposed to have, support that they're supposed to have in the schools. If you homeschool, then you go directly to them. And they have a whole program for that. The consumer directed, I can't remember the name of it. It's like consumer support services or something along those lines. I can, Shane, if you'll email me, I'll send you the information about how to get with their programs. Courtney, do you go direct then? I guess you mean, do you apply directly with them? Yes, I would apply directly with them. Okay, good deal. Okay. Oh. Okay. This is my last program that I want to talk about. It's the Family Support Program. It's a state-funded grant for people with developmental or severe lifelong disabilities. It results in substantial functional limitations in 3 or more areas of major life activities. So a person has to be a Tennessee resident. They have to live in the community in an unsupported setting, which means they can't live in a group home, foster home, can't be at King's Daughters, any of those supported settings. And they also can't be enrolled in a waiver. So the Family Support Program is going to provide a limited amount of funding per year for services like respite and equipment, vehicle modification, supplies, or camp. In Williamson County, we hold the family support contract. So you can reach out to our family support coordinator. His name's Alex Greiner, and he's wonderful. I'm a little biased, but he's great. So there's information on our website on how to apply. Amanda's linked it in the chat. In Murray County, Buffalo River Services holds the contract, and in Davidson and Wilson, the ARC of Davidson County in Greater Nashville holds the contract. And then I have a couple of other things I just want to tell you guys about. So this is our financial and estate planning seminar that Luke and Matt are going to do next week. April 30th, 2024 from 6 to 7:30, and it's here at the ARC. They're going to talk about conservatorship, special needs trusts, ABLE accounts, other considerations to make sure that your loved one keeps their access to federal benefits. So if you'd like to come, shoot me an email, because since it's in person, I just want to make sure we have enough space. And then lastly, we are starting a program for individual counseling for folks with IDD. And that's me, I'm doing that. And it's the only program that we charge anything for, and that's only to pay for my supervision. It's typically around $25 to $30, which is exceedingly low for counseling. So I just wanted to let y'all know about that as well. If you have any questions, just send me an email. And that's it.
We do have 2 questions in the chat, Katie. Julie wants to know, is the family support program for adult IDD children living at home?
Yes. Yep. They're living at home with you.
And
if they're living at home
with you
and not enrolled in a waiver, then yes, that is exactly who it's for.
And does Wilson County have their own ARC office?
I do not believe that they do. ARC of Davidson holds the family support contract for Wilson, so I don't believe that they have an ARC there. Could you use family support money for that counseling? Yes, you could. And I don't want cost to be a barrier for someone. I have to charge a minimal amount because I have an external supervisor that I have to pay, but I don't want that to be a barrier for someone. So if it's gonna be too much of a financial burden, just talk to me. We'll talk through it.
Katie, we have someone with their hand raised.
Yes.
I think they have a question. If you'd like to unmute and ask your question.
Sure, thank you. Hi, this is Monica Coakley.
Hi.
Going back to the transportation point,
Uh-huh.
we live out in rural Williamson County, and we have 2 young adults that don't drive. So transportation is a big issue for us. You know, we try to keep them working, but it means we have to drive them everywhere.
Right.
Are you aware of, I mean, other than taking our chances with Uber and Lyft, is there, you know, do either of them have any kind of more directed program where we can have drivers that are screened and that would be more safe for our kids? Or are there other alternative rideshare services that would be safer for our kids than just, you know, rolling the dice with Uber and Lyft?
Yeah. So, hang on a second. So,
And I guess related to that question is whether you have any training that you provide to young adults with IDD on how to use rideshare services.
so generally that's something that they should be covering in T2, but I know your kids are older.
And my kids were homeschooled.
Okay. So I was in a meeting last week where there was someone from the Transportation Management Association, TMA group. Stephanie Tillman was her name, and she was saying that they would offer some transportation. It's tmagroup.org. And like I said, her name is Stephanie Tillman. And I think that, I see Brooke on here. I think Brooke got her contact information. Did you get her contact
I have her
information?
contact. I have it. It's in my office.
Okay.
I have, so anybody's welcome to email me. I met with her at the meeting as well and just kind of talked to her about some needs that I know in the community and what they would be available to do for transportation. So anyone's welcome to reach out to me and I'll connect you and give you her information.
All right.
Thank you.
Are counseling services just for Williamson County? No. Is that TM?
We have a hand raised.
Yeah, I see it.